We see in our work every day that displaced girls, women and girls, consistently face heightened risks of human rights violations because of patterns of discrimination and inequality that are exacerbated during displacement. And we see over and over that conflict and crisis result in higher levels of all forms of gender-based violence. Women and girls are increasingly targeted with sexual violence as a tactic of war. Young women are at risk of trafficking and forced into sexual slavery. And displaced families may be forced to marry off their daughters in the belief that it can protect them from violence and relieve poverty. And we're actually seeing an increase in child marriage play out in real time. Right now, horrifying reports are coming out of Afghanistan of parents selling their daughters, even babies, in order to feed their families and pay off debts. And our research indicates that in order to address child marriage, you need multiple strategies, programs that combine interventions such as cash transfers, safe spaces for girls, peer-to-peer education, mentorship programs, all of these things so that they can come together, can make a difference. And the other huge risk factor for displaced women is the frequent disruption of sexual and reproductive health services. The lack of access to sexual and reproductive health care is the leading cause of death, disability, and disease in many refugee settings. And despite substantial progress that we have seen over the years in the rollout of guidance and getting a minimal initial service package of care that needs to be in place in every emergency, gaps remain, particularly for adolescent girls. And actually we saw during COVID that COVID disrupted sexual and reproductive health services. And part of that reason is that sexual and reproductive health services in crisis settings are still not seen as being essential or life-saving. And we know that refugee women, face enormous challenges, but we shouldn't think of them as victims. They are survivors. As we just heard from Phony and from Soraya, they are survivors, they are first responders, they are human rights defenders, and they're agents of change in both formal and informal peace building and recovery efforts. And as a humanitarian community, we really need to do a better job at ensuring refugee women's safety and health. And we need to find better ways to support their resilience so they can realize their rights and full potential. And this requires a major shift in humanitarian practice. And I also believe the recognition that displacement can be an opportunity to transform patriarchal structures and norms, right? It's really about incorporating deeper and more nuanced approaches in our humanitarian work. Just briefly, very briefly, we at the WRC, the Women's Refugee Commission, we're doing our part. We are advocating for the integration of gender equality into all humanitarian programs. This means taking into account power relations and promoting women's and girls' access to protective assets, such as health, education, and livelihoods. And importantly, leaving no one behind, especially the most marginalized. And we're also developing new approaches that promote the full participation and leadership of women and girls in crisis-affected settings.